Good morning, and thank you for joining us with the Caregiver Teleconnection Program. My name is Minerva Villarreal, and I am the Foundation Program Coordinator with the Caregiver SOS. Today's topic is caring can be rewarding but stressful, how to focus on the positives. And our presenters are Elliot Sklar and Lucy Barylak. And let me tell you a little bit about Elliot. Elliot is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is a professor of health science at Nova Southeastern University in Florida. He publishes and presents his work internationally, focused on the complexity of issues related to aging and caregiving. Now, Lucy Barylak received her degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and longstanding manager of the Caregiver Support Center, a multi-service respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, on the basis on her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. She has published numerous articles and has presented at major conferences on her research findings. Lucy is also a liaison supervisor at the School of Social Work at McGill University. And something else that Lucy would like for you to know is that she was also a caregiver to her mother. And with that, take it away.
Thank you so much, Minerva. Good morning, and thank you for joining us today. We have a very exciting program to share, which is a bit unique. As we approach the end of the year, it's a good time to take a pause and reflect. We could take stock of all the challenges that caregivers have experienced, or we could end out the year by focusing on the positives as a way to begin a new year with a new perspective. We're going to provide a lot of tips today on how to build the positivity of caregiving. As we reflect upon the past year of programs that we've offered, our focus has really been to support caregivers by acknowledging the challenges that comes with caregiving and to provide resources and solutions where possible. As caregivers and as healthcare workers, we can often get caught up in focusing upon the things that are negative or difficult. And for many of us, that is just human nature. As caregivers, we help with people's challenges, not their solutions or resolutions. So it's not surprising that we're often more used to thinking about what we can't do or on the negatives. And it is hard to watch someone's health decline. But there are also positive aspects of caregiving. And I know that from personal experience caring for my mother. So today our focus is on those positives and how to take control of what is possible. Having a positive outlook as a caregiver is really associated with better stress management, which links with better health outcomes for caregivers and care recipients. Caregiving is an emotional journey, often because of the close relationship we have with our care recipients. In addition, many elements of caregiving are out of our control, which is something that is difficult for the best of us at times. Now, I want to talk a little bit about research. Research on caregiving has often focused on reducing the caregiver's burden, but less attention has been given to promoting the positive aspects of caregiving, and there are many. There's a growing body of research that's showing that caregiving is not solely only burnout, but can also yield positive outcomes like growth, meaningful, strengthening relationship, For example, in a national Canadian sample, 73% of caregivers who identified at least one positive aspect of caregiving had lower depression, lower burden, and better self-assessed health. So with that, Elliot, I will pass it to you.
Thank you so much, and thank you to all of those joining us today. It really does go to show when you look at some of this research that perspective is everything. And it's not just the research, it's also all of our years of working with caregivers and learning from their experiences and the things that are meaningful to them. Lucy, you had mentioned control, which I think is so important in our discussion. Caregivers often feel like they're reacting rather than choosing. Like the waves might be carrying them rather than them steering the ship in the journey that is caregiving. We also hear that a lot of caregivers feel out of control because of the trajectory of a disease, for example. It isn't within our control, or the behavior of a care recipient, which can change. Time demands, financial pressures, these are all outside of a caregiver's direct control. There's an emotional impact of all of this, which can lead to helplessness, anxiety, resentment, and exhaustion. Now, if we focus better on what can we control, we might find that it's not a matter of what we can control, but what we're able rather to influence. There's a difference. Control doesn't mean total power. It means agency, which means having some degree of control, even if that's how you react to a situation. So, being part of the decision making process, practices, mindset, and relational actions can all extend to a level of influence. So, it's a little bit different. We have primary control, which is where we can directly change something, and then secondary control, which is adapting or reappraising. Caregivers might oscillate between both. For example, we can't take primary control over an Alzheimer's disease diagnosis. We can't change that directly, but we can take secondary control by adapting to the diagnosis as best as we can and appreciating the good moments as much as possible in the present rather than worrying about all of the future what ifs. For example, self efficacy, which is the concept of believing in oneself and one's own capacity to handle things, is significantly associated with the perception of positive aspects of caregiving in Alzheimer's disease. So, again, the ability to enjoy present moments without worrying about the future what ifs because of a belief that we can handle what comes really helps caregivers to feel like they have better control, even if it is just a matter of how they're adapting. Because again, we can't control that Alzheimer's disease diagnosis. So when caregivers recognize that they can actually influence their responses, their routines, boundaries is a really big one, coping strategies, we can shift from reactive to a proactive stance. Now, if you think about that for a moment, really that's the ability to regain some sense of control over things. Again, we cannot control how someone might behave. We know working with caregivers that behavioral issues, emotional outbursts, that can be really, really upsetting. But when we're able to recognize that we can manage those things better or respond or adapt to those things better, caregivers do better. And that leads us to acceptance.
That's a big one, Elliot. But I do want to talk about that. Alzheimer's and dementia caregiving can be really tough because you lose the relationship and the psychological bond with that person in many ways. As these diseases progress, there are lots of physical needs that the caregiver has to provide, in addition to managing the emotionals around the relationship, along with everyday life and responsibilities. There are negatives and challenges, and the goal of our program and sharing of information is not to discount this at all. It's quite the opposite. This is part of the process of, as Elliot said, acceptance. So, what is acceptance? Acceptance is necessary for your healing process. To practice acceptance, you must acknowledge all the uncomfortable parts of yourself, your emotions, your thoughts, and your past. The concept of positive aspects of caregiving, referring to the rewards, the growth, the resilience, and meaning found in caregiving that co occur with stress. Again, this is not to minimize the burden, but to enrich the narrative and open pathways of acceptance and meaning. I do want to look at a review on a research that an article that examined more than 50 studies to explore how positive aspects of caregiving can have a benefit on your well-being. That includes personal growth, gratitude, mastery, finding meaning, knowing that their loved one is getting good care, letting go of anger and guilt, and modeling caring for others. For example, caregivers who have children often report that they feel they are setting a good example by the role that they play as a caregiver. Another research project I'd like to talk to you about is about 5 years ago, a study was published in the International Journal of Nursing Studies focused upon positive aspects of caregiving in dementia. This research looked at the findings of almost 4,000 articles on caregiving, of which only 40 articles related to the positive approach of caregiving. No study since this one has examined this theme. So that's interesting to look at that. The findings show positivity in 4 areas. So, one, a sense of personal accomplishment and gratification, feeling of mutual and getting closer in the relationship, increase of family cohesion and functionality, and a sense of personal growth and purpose in life. The study also showed the importance of having personal acknowledgement of one's caregiving role, meaning you need to acknowledge what you're doing, which is to mean that the praise and recognition of one's caregiving role and responsibility is really important in helping caregivers see the positives. This is why it is also so important that healthcare workers validate the role and the experience of caregivers and think, what is the most and how to support them. But by you personally acknowledging it and as workers acknowledging it, it certainly gives, there's a sense of accomplishment.
For sure. I think that's so important. And as we're talking about this today, as Minerva shared, I work as a full-time professor. I mentor doctoral students. Whoops. And I am working with one right now who works in the domain of caregiving. All of her life, professional experience has been working with older adults and caregivers in Alzheimer's disease. And we just completed a study actually looking at hours of caregiving and life satisfaction among caregivers. But what we did was a bit different, and we looked at this from data from a national US survey, which is called the Behavioral Risk Factor Surveillance Survey. What makes this different? It doesn't specifically look at caregivers. Of the, I think, 40,000 US adults sampled for this survey, which is done every year, this past cycle, they did look at caregiving and asked a number of questions. And we were able to do an analysis on hours of caregiving and life satisfaction. You would expect to see that as hours of caregiving go up, life satisfaction among caregivers might go down, because that's what a lot of our research shows us. We didn't find that in this study. And it might be because the sample didn't come from a group of support-seeking caregivers, which is often where participants for caregiving research are found. So it's an interesting shift also when you think about it. It's like doing research on obesity and getting people from a Weight Watcher meeting versus just sampling a group of people, let's say at a theater, about their feelings about weight. And what we're seeing is that when we look at a general population, rather than looking at support-seeking caregivers for research, we're finding that there are more positive outcomes in that research. So it's very interesting. I think part of the findings are based upon how caregivers self-identify and what their own unique experience is. So I thought maybe it would be a good time just to pause before I continue on, and to see if anyone has anything that they want to share from their own experience, good or bad.
All right, everybody, if you would like to participate, go ahead and unmute yourself. If you don't have the ability to unmute yourself, go ahead and type it out in the chat box, and I'll be more than happy to read that out loud. Nothing at the moment, Elliot.
All right. Well, you can all think about that because we will be asking for your input again. But I just wanted to share, what I was working on this morning and how topical it is to our conversation today. And I'm really excited for us to publish the results of the study, which show that as the hours of caregiving needs increased among spousal caregivers, their life satisfaction did not decrease. And that could very well be because of the positive aspects of caregiving and mindset. So, part of our focus today is on how caregivers can take control of what is possible. We recognize, as Lucy said, that the journey of being a caregiver is just that, it's a journey. Not all days are going to be good, but we may have good moments, and that's the key. We don't often practice living in the moment, and it's an important practice because it means being able to be more present for those good moments and to have them make a significant impact in reinforcing the role that caregivers play. Now, according to the American Psychological Association, many caregivers report that they find benefit in their role and activities. There's an increasing there This is seen increasingly as a positive form of coping with stressful circumstances and situations. So benefit finding may be a product of the ability to find meaning through positive reappraisals, spiritual beliefs, or other adaptive coping mechanisms in the face of stress. In fact, many caregivers who reported these benefits and positives also reported lower stress. Caregivers who perceive more benefit from caregiving also reported lower depression, and this sense of satisfaction and well being can have very important benefits for caregivers well after caregiving has ended. And that's very important too, because that journey doesn't end when that person's health, takes a turn, unfortunately. The journey of the experience of caregiving can exist well after we are no longer caring for that individual. So, how do we get to a place of being able to focus on the positives? Well, that can take some work and some dedicated time and effort, especially for those of us who are not used to seeing the cup half full, or if that's not our general predisposition. So, there are some things that we're going to recommend because it's a process. Some of that includes some reflection, and it's really up to you to build something for you that is feasible that you can incorporate into your day. As an example, some caregivers find it helpful to write a positive down on a post-it note. And this is something we've talked about in previous programs because if you look at the collection of those post-it notes, you can see a commonality to the themes in which you're finding positives. It's one helpful tip. But we've also found that caregivers often don't address their own needs. And that can really be at the base of everything. Because if you don't make yourself a priority, everything else can feel out of control and overwhelming. So we can't reinforce it enough how important it is to take some time so that you do exactly that for yourself. It can be a 5-minute meditation, reading, painting, doing a little drawing, watching a TV show, or even just taking a time out. And sometimes taking a time out and going to the bathroom for 5 minutes can be very helpful for caregivers. It's unique and it depends on the circumstance that you're in. There are also great exercise classes that you can do from home without equipment, and that doesn't require much respite care. So taking a few minutes out for yourself, no matter what joy that brings you, it could be being out in the sun when the weather permits or out in nature, which can be helpful, even just taking some fresh air outside. What we have found and what we found in research is that caregivers who feel healthier and better able to care for themselves have a greater inner reserve to draw upon when things get stressful when you're providing care. That's why I've always believed as much as possible in the power of health behavior. That's why I work in public health with the focus on health behavior. When we engage in behaviors that support our health, we are showing ourselves care, but also we're being our best selves. Now, this isn't to say that I don't enjoy wine and cake, but I also strongly believe in balance. So, for example, the power of other good nutrition, exercise, and sometimes it's a cue when we feel like we need that piece of dessert. Exercise is also a great practice of living in the moment. When I am on the elliptical machine and I am huffing and puffing away and uncomfortable and can't wait for the minutes to pass, I am mindful of every minute that I'm on that machine. And when I'm able to get off of it after my 30 minutes, I feel like I can take on whatever the day gives me. So, taking control of what's possible really starts with ourselves, with our own health and our own well being. When we're physically better, emotionally better, we're better poised for success in other areas of our lives and better able to see the positives. So, Lucy and I will be hosting other programs on the benefits of physical activity and nutrition for caregivers in the new year. We hope that you might participate in those as well. But on this slide, we did also include a link to some previously recorded programs in these areas, which might be helpful. And as always, we will provide a copy of our slides after our presentation today. And anything you see underlined in a blue is a hyperlink that you can click on.
Thank you for that. Go ahead, Minerva.
There was a comment that Judy made, and I just wanted to share it before we continue.
Sure.
Yes, I agree. Taking time out to do things for myself that I want to do helps me feel better. It's good for me to get away from being consumed about my loved one, getting everything that they need all the time.
Thank you so much for sharing that. And Minerva, thank you for reading that. For whatever reason today, I'm not seeing our chats. I'm just seeing my slides. So feel free to share any other chats that come through, and feel free to share any thoughts that all of you have as we're presenting today.
Yes, thank you for that. I'm going to go back to the research, to some research that sort of really kind of puts it all together, what Elliot was just talking about. So a few years ago, there was a study published in the journal Health Psychology looking at caregivers of people with dementia and positive coping skills. Okay. Caregivers participated in a program and received video calls every week where a facilitator taught them skills. And let me tell you what they taught them. These are really good tips. That is so important, noticing positive events. Elliot spoke a little bit about that. Being aware of the good things in your life. Um, is on, it's really an antidote to only focusing on the negative. So it's so important to be aware of the positive things that are in your life. Capitalizing on positive events, that sort of goes together. A way of extending and savoring your good feelings, such as by telling someone else, writing them down, or remembering the event later. Like, really think about that. Something nice happened. You were with the person you're caring for. There was a nice interaction. There were smiles. Those are such important things to keep in mind. Now, mindfulness is huge. Being aware of the present moment without judgment. Participants learned a guided mindfulness breathing exercise, which you can actually find on the internet. And they incorporated it, a mindfulness, into daily activities like brushing their teeth and washing dishes or whatever, by being very focused about their mindfulness and about their breathing. Now, also noting personal strengths. It's so important to recognize the personal resources you have, and how you sort of behave. Like, really look at that and how you incorporate that into your life as an antidote to feeling helpless. Like, what are your strengths? Are you patient? Are you resilient? These are things that are important to keep in mind and really focusing on them. Now, the other one is setting goals, okay? Attainable goals. Choosing goals that are challenging, but not too challenging, allowing you to feel accomplished and successful. Goals should be specific, measurable, achievable, realistic, and time bound. These are known as SMART goals because goals can be hard to set or recognize. Okay, so don't overdo it. If you can't do everything that day, then just set smaller goals. These skills help caregivers feel more in control of their responsibilities and better able to manage in general. So, as a caregiver, it's important to try to practice these on a daily basis. Maybe start with just one, even even every other day. Maybe these things, put them on a post-it note, as Elliot was saying, inside your bathroom, cabinet, or somewhere else. Only you can see it, but regularly. So it's kind of a reminder. Another idea is that if you know any caregiver or yourself or anyone in your life, there are goals, great skills that you could make a habit of practicing. For example, noticing positive things in others or among other caregivers as well. You can say, "Hey, you handled that situation really well," or "I notice how well he or she or they are doing or in adjusting." Just focusing on the positive really expands the positive around us. But what I want to say is that negativity can be a habit. We need to break that pattern. And one of the things that I suggest is try to stay away from people who are mostly negative. Okay, I know sometimes we can avoid it, but it just gets you into a spiral and it's really hard to get out because try and be with people who are positive. It's okay to how you feel, but it's something that you should really practice.
That's such good advice. I really try to temper the people in my lives in terms of those who take from my bucket and those who give to my bucket. And,
Exactly.
I think that's a good thing to practice at any point in our lives. I was very curious as you were going through all of these wonderful tips, if any of our participants are actually practicing any of these. Did any of these resonate with you? Are these any of these things part of your daily routine or repertoire? Please share with us.
Okay, there was actually another comment that came in from Leanne. Living in moment is often difficult for me due to continual and increase in repetition. Also, I am finding it difficult to get away alone to do things on my own. I'm in process of hiring a companion person for our home for a few hours per week. Just started with someone. I know it will take time. This is not something that my spouse wants, but I am still having her come to get to know her at least. I do make it to exercise class and lunch with friends. I also walk, swim with my spouse. The out of the norm behavior, very out of the norm, coping skills are paramount. Working on that with a social worker.
That's great. That's really part of acceptance. And sometimes it's not only acceptance of where the person you're caring for is, it's acceptance of what you can do and not do. And so that, we always say, Elliot and I, it's a balancing act. There's two people in this relationship. One does not outweigh the other. So thank you so much for sharing that. And the whole idea of acceptance, and you recognize that you need to get away by hiring someone, is the right way to go.
Yes, you're doing all the right things. I have no notes. I can only say that it's important that you take stock and recognize all of the effort that you're making and all of the right things that you're doing to try to help yourself and your loved one as best as possible. One small piece, a little tip, something that helped me during some difficult caregiving times when I was with my mom and she was in palliative care. I didn't have the opportunity to take breaks or to feel very positive in that experience. But I needed to balance. And I would find that I would leave and take a walk down the hall and listen to a joke from a favorite comedian. I really like Joan Rivers, so it was really easy for me to look up some of her stand-up and books and things on audio that I could listen to. And for just a few moments, it gave me this great ability to find some lightness. That's something that helped me. But there are many, many things that we can do in very small moments to sort of find a bit of an escape. And it's really unique to each of our personalities and the things that we find comfort in. So I would encourage you to think about, those small moments and what you could do to perhaps bring some lightness to your life and experience.
Thank you.
I
Thank
I
you.
do have a recommendation. I don't know if it'll be helpful for everybody, but I know for me, when it comes to noting the personal strengths in the bathroom, not on a permanent marker, I write three things that I consider are my strengths. And whenever I'm having doubts, I just go to the bathroom, I read those out loud to myself to remind myself there are positive things.
For sure, for sure. And as Elliot was saying, for me, it's music. It's putting on music. And if my mood is down, I'm not going to put a song on that's going to make me more down. So I'll put a song on that maybe I can just dance around my living room a little bit. It's whatever you feel, because it's so important to not allow those negative emotions to linger on because they can turn into depression.
I just advanced our slide because it seemed appropriate since we're asking all of you to share your tips and how these things resonate with you and any challenges too. Does anyone have any tips that they would like to share on things that have been helpful for them?
Go ahead and unmute yourself. If you've called in, you would do *6, or go ahead and type it out in the chat box, and I'll be more than happy to read that out loud for all the participants. What has worked for you to stay in the positive?
And Minerva, thank you for sharing your suggestion. I think it's such a great idea because it also takes the two sides of the coin in a sense. You put that list of three things together when you're feeling good, and then it gives you something for yourself to refer back to when you're not feeling so good. Um, I like
I
that.
I definitely can't take credit for that. One of my therapists at one point in time said, put that in the mirror so when you wake up, that's the first thing you see.
Hmm.
And since then, I just expanded on it.
That's great.
Anyone want to share?
I would just say that I try to keep a gratitude list. I don't care how bad the circumstance could be. I always think of one thing that bring me gratitude, and that's take me from that minute to the next half an hour of whatever time, and just be kind to myself.
That's one of
That
the keys
is
too.
great.
To being kind to yourself. I'm going to speak a little bit about that, but that is so important. Thank you. Thank you for that. And
Thank you, everyone who's been sharing with us.
for sure. And
All
I guess
right.
it all goes back to the whole idea of acceptance.
Yeah, absolutely. And that, this is a practice. It's not going to be perfect all the time. And I just saw, for whatever reason, now I can see the chats. I just saw one from Judy. You are speaking to me today. Thank you. Lots of confirmation. Stepping away from those people that my drain to my bucket, like that take away from my bucket, and those that give to my bucket, and vice versa. Also, I escape when I can. Getaways overnight to the coast by myself. Walk on the beach. Watching the sunrise. Talking to the Lord. Also, one on one with friends, time with the Lord in the morning, reading the Bible, journaling. These are all things in which people find meaning, and thank you for sharing. These are great examples. Now I can't close the chat. There we go. Um, I'm grateful that I can maneuver technology today. It depends on the day. So we know that not every day is going to be a walk in the park, obviously, but it's important to try to live in those moments when the moments are good, because there will be good moments and not so good moments. And we need to cling on to the good moments with all of our might. That can be very different for everyone. For example, a day without having to handle difficult behaviors can be an important thing to appreciate for some caregivers. And I don't even know that some caregivers recognize if they're having a day without having to deal with difficult behaviors. So that's why when we take stock of things that we don't even think we're going to find to be something to find gratitude in, you never know. Happy moments can mean different things depending on our circumstances. When people have short term memory loss, their lives are made up of moments. So we are not able to create perfectly wonderful days for people with dementia or Alzheimer's disease, but we can certainly help to create perfectly wonderful moments. These are moments that put a smile on their faces, maybe a twinkle in their eyes, things that make us feel like they're feeling good, and maybe we're part of that. So 5 minutes later, they may not remember what happened or what was said or done, but the feeling that we have left them with will usually linger. And the same holds true for us as caregivers. So it's really important to remember those moments and that practice makes progress, not perfect. I would encourage everyone participating or listening in today to write down one happy moment with your care recipient that resonated with you. Maybe start out with one for the week. Maybe you can build up to one for each day. But see what the sum of those experiences look like. I mentioned it earlier, and I know that it might seem trite, but it's a practice that really does help to change our focus because we can better look at what those themes are in the things in which we're finding fulfillment and joy. And I do have a question, Lucy, for you, because I know sometimes it's not always easy to be positive. And so when we're not in the mood or when we're having an especially difficult time, what are some of your suggestions on things that we can do?
Well, I would definitely go back to the idea that when you're experiencing something stressful right now, feeling upset is, totally uh, appreciated. For example, okay, you have to acknowledge it. If you get bad news from a doctor or aren't feeling well, are you going to get even more upset with the situation because you can't see a positivity in it? It's okay to give ourselves permission to feel bad, to feel down, sad. This can be very normal feelings to process. And on a personal level, I give myself a day. I wallow in my sorrow, I'm very aware, but it needs to be time limited. Okay? If all those feelings, you can't get rid of those feelings, you really do have to go possibly and see your doctor because it can turn into depression. So, in that moment is where some of self compassion, and this is what we were talking, Elliot was trying to explain before, would be most appreciated. Yet, it's not something many of us think about. Self compassion can be an extremely positive habit to nurture that doesn't have to do with smiles or associated with positivity. Gratitude can be simple, it can be very, very simple. For example, we can be grateful for our resilience or our strength in the force of bad news, or for our ability to have the support we need to cope and to get through it. So love yourself. It's okay. You're allowed. You can acknowledge who you are, that you're a good person. Sometimes you're not so happy, or sometimes you do things that you kind of forgive yourself. It's okay. It's very, very important to do that and not be so hard on yourselves.
And that's, unfortunately human nature for many of us. We're very hard on ourselves, and this is definitely a circumstance in which we should be trying to give ourselves as much grace as possible. Now, I know many caregivers, as I said earlier, feel a lack of control, that they were thrust into the role of being a caregiver, that they didn't choose it. So we're going to flip the script a little bit. And I would like everyone participating today to think about one more thing. And I've posted a statement here. I am grateful to be whomever's caregiver because. Now, I want you to think about that in relation to the person or clients for whom you provide care. The use of the word grateful here is purposeful because we don't often experience gratitude around the role of caregiving. In fact, gratitude is actually very important in helping us see the positives in things. So we're going to circle back on this, but is anyone willing to share with us how they might want to complete this statement?
Okay, everyone, if you would like to share, please go ahead and unmute yourself. Or if you don't feel comfortable talking, go ahead and type it out in the chat box.
And you might not yet feel ready to fill this out. It's a huge shift in how we think about our role as caregivers, right? When was the last time you thought about how grateful you were to be someone's caregiver? So I'm curious, even if you don't have an answer, how this statement even makes you feel.
It's very touching, I have to say. So maybe I can share. I was very grateful to be my mother's caregiver because I truly loved her and she took such good care of me. And the person that I am because of her in many ways.
And that's very touching. And I'm sure many people who are participating can relate to that.
And like you said, some might not be ready and only focus on the negatives. I know I'm having a hard time coming up with a positive right now, but it is the holiday seasons for me, and that's never good. Debbie wrote, I was grateful to be my husband's caregiver because he had taken care of me for our entire marriage. That
That's so
is
nice.
beautiful.
What a beautiful tribute. So I want all of you to think about this, even after our program, because I think it's one of the most impactful things that we can leave you with. And if you're struggling to complete this, it means only more that you need to, because you need to do some internal work to think about those positives in your area of gratitude. And
Okay,
again,
we have
oh,
one more comment from Leanne. I am grateful because I have loved my husband for nearly 50 years. We have had a great life, and I will do my best to make this part of life as lovely as possible for as long as possible.
I love that. Thank you so much for sharing. And I just wanted to put up this slide because it has those tips that Lucy shared with us earlier about what to do when you just don't feel like you can really rally and feel gratitude in a given moment or feel the positives. And so it's just a reminder to practice permission, self-compassion, and to practice that thought of gratitude. It might take some of you a lot of practice working on that last slide to fill it out. The things that you're grateful for in being someone's caregiver, because the day to day can feel very challenging. And again, that we didn't choose this role. But again, we might not have control, but we may have influence. And influence is very important because we're part of that influence. So if we're able to change our perspective, how we view things, it will enhance our experience. And most likely that for our care recipient as well.
And it's such a timely time of the year where we make all kinds of, okay, this year I'm going to exercise more, this year I'm going to do this. And I think this, if you're a caregiver, is such an important thing to kind of give yourself a gift almost, if you can, by looking at some of these tips and to really think about yourself and what you are, what you need as well. It's very important. And to be able to kind of challenge yourself to actually do it. Some of these tips of looking at the positive um, aspects of life.
I wanted to know from our participants today, what are some of the strengths that you recognize in yourselves as caregivers?
We have quite a few saying something.
Now we do.
Okay.
Okay, Jose put, I like Minerva's thinking, I feel like I'm becoming my wife's caregiver. My wife has been her mother caregiver for the past 3 years. I see how she is feeling depressed and overwhelmed. Even though there are more female siblings, I feel they don't put their part in this. And then Rosalie put, will there be a recording sent to us on this? I missed most of it. Yes, this is being recorded and will be posted on our website.
And Jose, thank you for your comment as well. I'm sorry to hear about what you're seeing in your wife, and perhaps you are able to take some of these points from today to discuss with her ways that you're grateful for her, and maybe ways that she has been able to experience gratitude in being her mother's caregiver. But when we focus on the positives, as we keep saying, those positives seem to expand. And that's really our hope, you know? Anyone else? Any strengths that you've thought about in your own experience as a caregiver through our discussion today?
Would you say patience is a
Of
strength?
course.
Yes, 100%.
I would say all the caregivers on probably have patience, and that would be your strength.
I would expand patience, resilience. Um, there are so many things. You know, we heard from many caregivers today, and what was really the theme that I could take away from the gratitude that they felt for being a caregiver was that it was almost a sign of mutual respect and love, that they felt cared for, and in turn, they were providing care. And it's very much in life, you know, when we give to others, we get back. So, you know, this is just an extension of that, but that's why you need to keep that cycle going and not see it as the end, perhaps, of an exchange, but rather how the exchange keeps going, how you keep benefiting and feeling fulfilled from it, what the positives can be, what that person's legacy what you want that legacy to be, how it will be positive. You know, these are all things to focus upon, and we can't obviously touch upon everything in one program, but we hope certainly that, you know, some of the research that we shared and also some of the resources and some of the tips might be helpful for you moving forward, not only now at the end of the year, but also moving into a new year so that you can begin on a positive footing. And I wanted to share, as we always do, you know, we pride ourselves on providing so many resources because they're so important, obviously, for caregivers. But I want you all to take stock of the resources you already have within you. Minerva said patience is one of them. I would agree with that completely. But there are probably more. So you might want to list them out. What are the strengths and resources that you have within you? And certainly, if you do need some resources, we have the WellMed 1-800 number here on the slide, which Minerva also provided. And also remember that there still is the 988 mental health hotline when you're feeling in crisis and you need to be in touch with someone. The great thing about that for caregivers too is that they also do this by text. So that if you're not in a place where you can freely speak with someone, you can at least text and exchange some messaging with a mental health counselor. So we hope that these are going to be helpful for you. As Minerva said, the program is recorded. We will be sharing our slides and the presentation. And if anyone has any last questions, we open it up.
Go ahead and unmute yourselves or type in the chat box. I'll be more than happy to read it out. Elliot, Lucy, this has been a great presentation.
Thank you. We're so glad. I love hearing positive feedback.
Yours are always great. You guys are awesome.
Thank you.
I don't see anyone unmuting themselves right now, so
Okay.
I'll go ahead and do a little bit of housekeeping. We have a couple more teleconnection sessions for this month. We have coming up on Tuesday, December 9th, Making the Case for Music and Dementia Care with Justin Russo. Then on Wednesday, December 10th, we have our Spanish session, Cómo disfrutar la Navidad en momentos difíciles, and that's going to be with Leti Guzman Sanchez. And then our last session for the month, it's going to be the holidays and dementia, tips for making the holidays more enjoyable with Holly Lowe. And Jose put, thank you, great presentation, very informative. And I am gonna go ahead and start the poll before you all leave. This is how we know what you thought of the presentations, if there's anything you would like to see in the future, anything you would like for us to change for this coming year. Elliot, Lucy, anything else you would like to share in the meantime?
Well, just take care of yourself. Holidays are coming. Don't overdo. Enjoy the small moments, the little things that just make you happy.
What a perfect time to be practicing our appreciation, at this time of the year. And also, I think self-compassion. Many caregivers feel a lot of additional stress and pressure around the holidays. But again, this is a great opportunity to pivot, focus on the positives, even if they're small moments, even if you can't join others in celebrating. Maybe you can over Zoom for a few minutes, or Facebook, or FaceTime, or whatever it is. Just do what makes you feel good for yourself right now, and let that be your gift to yourself for the holidays. So I hope that what we have shared resonates with all of you and helps to keep you in good spirits over the holidays and into the new year.
Happy New
Definitely. Go ahead, Lucy.
No, Happy New Year, everybody.
I do want to share something that I found recently in Amazon with being grateful. They have grateful jars that have different sayings in them. And whenever you're having a hard time, you just open up the jar and pull out one of the papers and just read it out loud. And this is also another way that you can alter it for yourself if you want. If you have a little treasure box, write down what you're grateful for, put it in there. Then if it comes a time that it's hard for you, just go back to it and read what you wrote down, just to remind yourself.
Minerva, I'm so impressed with you today. You have really wonderful tips. I love it. Thank
You guys are rubbing off on me.
Anyways,
They really are great tips. I
yeah,
love what you wrote about the strengths, what you said about writing down the strengths.
yeah, absolutely.
We have several thank yous in the chat. I don't see anyone unmuting themselves. Elliot and Lucy, any final words before we stop for today?
Nope.
No,
Okay.
It was a pleasure, really.
And with that, I want to say thank you. I want to thank the WellMed Charitable Foundation for offering this program for us every year. It has been a couple of years that we've been doing this, and we hope that you have a very merry holiday season, because I know there's different holidays out there, and hope you have a great beginning of the new year, and we hope to see you coming up in the next one. With that, I will stop the recording. Thank you, everyone.
Bye. Thank you so much. Bye.
Thank you so much. Bye-bye.